guys, welcome to another lecture, and today we'll be discussing something about differences between three conditions of a newborn, that are gastroschisis, omphalocele, and umbilical hernia. So these are three similar looking, these are three similar looking or similar, easily confused things or diagnosis that may be missed. So as you know that the midgut rotation, usually what is the issue is that there is a 270-degree midgut rotation. Normally the gut goes out, it elongates, it rotates, and it comes back in the abdomen. So whenever this issue is there, usually we have omphalocele. Gastroschisis is actually a weakness in the weakness in the wall, or the issue in the wall, which might lead to an entire open gut contents. Okay, so these are the primary two differences. We'll note them down. So omphalocele versus gastroschisis versus umbilical hernia. Okay, so these are the three conditions that we will be discussing today, basics. Okay, so firstly you have to understand that omphalocele has a sac. Omphalocele has a covering. Omphalocele, the gut is not lying outside like anything. There is a covering of peritoneum. There is covering of Wharton's jelly. There is a covering of amnion. Okay, so there is a covering that is there. Even Richter's fascia is there. So Richter's fascia is also there over in this omphalocele. Gastroschisis has no covering. Okay, the gut contents are open, and they are lying outside, and that is the issue. Umbilical hernia has intact three levels. Okay, all three layers, subcutaneous, skin, all that layers are there, so there is no issue. It is due to the weakness in the muscle. Okay, now location of the defect is very important in omphalocele. The location is umbilicus. Okay, umbilicus is the primary, center in the umbilicus. This is the primary area, because the closure or the closure or the area, the herniation, the failure of abdominal, usually see the bulging or the outpouching is there in the from the umbilicus region, which there is failure to return. Now in gastroschisis, usually there are para-umbilical, right-sided para-umbilical area bulging, right-sided usually, and in umbilicus there is an intact skin. In umbilical hernia there is an intact skin. Okay, now associated abnormalities. The most common cause of death in a patient with omphalocele are the associated abnormalities, and it is seen in around more than 50% of a patient. If a patient is having omphalocele, you have to rule out the other defects that might be associated, like Down syndrome, Klinefelter syndrome, even the cardiac defects, respiratory defects, other defects might also be associated. While with gastroschisis, less than 10% will have associated abnormality. Okay, and in umbilical hernia, there is no associated abnormality usually, though hypothyroidism might be there. Atresia is not usually occurring in omphalocele, because the gut defect is there is no blockage anywhere, but in around 10% of cases with gastroschisis will have atresia present in the path of the gut. So that is the issue. In umbilical hernia, unless it becomes entrapped and it becomes necrosed and all that issue is there, then only there might be entrapment for the issue. Prognosis of the single most important factor of omphalocele prognosis are the associated abnormalities. If cardiac anomalies are present, or if life-threatening brain malformations are there, obviously there is nothing you can do. Associated abnormalities are the most important factors of prognosis, while in gastroschisis, the bowel motility is the main factor. Now you have to understand that amniotic fluid that is there, it decreases the bowel motility. Okay, so direct contact with amniotic fluid is there in gastroschisis. So usually the bowel motility is absolutely absent in gastroschisis. While in omphalocele, the bowel motility, unless the pouch is ruptured, is absolutely normal, because direct contact with the amniotic fluid of omphalocele is usually not there, because there is a covering. So if the covering is not there, then bowel motility will be decreased. But in gastroschisis, invariably there is no covering. That is why the bowel motility is, always impaired. And in umbilical hernia, the bowel motility is absolutely normal. So I hope you understood basics about this. That's all for today, guys, and I will see you in the next one.